Welcome back to Joint Ventures, an OSC original podcast. I'm Dr. Jeffrey Carlson, fellowship-trained spine surgeon at Orthopedic and Spine Center in Newport News, Virginia. Today, I want to talk about something I'm seeing more and more in clinic. Patients getting MRI scan results before they ever speak to a physician, then trying to interpret those results and finding out what they actually mean on their own. Sometimes that means going to Google, sometimes it's Reddit, TikTok, Facebook, and now increasingly ChatGPT and other AI tools. Patients are uploading their MRI reports and getting instant explanations within seconds, and honestly, some of that can be helpful for patients. I think patients being informed and engaged in their care is a good thing, but I'm also seeing the downside of it. People reading words like degeneration, disc bulge, tear, stenosis, or arthritis, and immediately assuming something is seriously wrong. By the time they get into my office, they're anxious, scared, convinced they need surgery, or worried they're permanently damaged. One of the most important things I tell patients is this: your MRI scan is not your destiny. An MRI is a tool. It's a one piece of information. It's not a diagnosis by itself. In spine care especially, we see abnormalities on MRI scans every single day in people who have absolutely no pain at all. If we took 100 patients walking around a grocery store with no symptoms and scanned all of them, many would still have disc bulges or arthritis or degeneration or narrowing somewhere on their imaging. A lot of what patients read as damage is often just part of the normal aging. The challenge is that MRI reports are written by radiologists to be extremely detailed and thorough. That's their job. But those reports aren't necessarily written with the patient interpretation in mind. So when someone opens the report alone at night on their phone and sees a long list of findings, it can sound terrifying without the proper context. And that's where I think technology is creating both benefits and problems at the same time. AI tools like ChatGPT can absolutely help explain terminology in simpler language. They can help patients feel more informed and prepared with questions. But what AI cannot do is examine you. It doesn't know your symptoms, your strength, your reflexes, how long you've had pain, what movements bother you, and whether the MRI scan findings even match what you're experiencing clinically. Medicine is still about treating the patient sitting in front of you, not just interpreting an image. I also think we're entering an era where more testing is being marketed as better healthcare, and that's not always true. Recently, there's been growing discussion about full-body MRI scans being sold almost as peace of mind wellness screenings. Radiologists at the University of Michigan recently warned that these scans actually create unnecessary anxiety because they often find tiny incidental abnormalities that may never cause a problem in someone's lifetime. But once people see those findings, it's hard to unsee them. Now they're worried. They're chasing more tests, more imaging, more appointments, more opinions, sometimes for things that were never dangerous to begin with. And on that other side, sometimes a scan can create false reassurance. Imaging is not perfect. It's simply one tool in a much bigger picture of patient care. I think we also underestimate the psychological effect imaging has on people. Once someone reads that they have degenerative disc disease, they start identifying themselves as someone with broken or damaged spine. But pain is incredibly complex. Some patients with severe MRI scan findings function at a very high level with minimal pain, while other patients have relatively normal imaging findings. They may suffer significantly. That disconnect is exactly why clinical evaluations still matter so much. My advice to patients is this: don't panic over imaging findings before you've had a real conversation with your physician. Use technology as a resource, not as the final answer. Ask questions, be informed, but understand that context matters. The goal is not to treat the MRI scan report. The goal is to treat the patient. Thanks again for listening to Joint Ventures. If you know somebody currently stressing over MRI scan results or spiraling after reading a report online, share this episode with them. And as always, if you're dealing with neck pain, back pain, or spine concerns and want help understanding what your imaging actually means, we're here to help.
Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.